Hi everyone. We've been working intensely over the past weeks on our immediate and future response to COVID-19. Australia has already had more than 465 confirmed cases, 1/3 of those reported in just the past 48 hours. And in Victoria, there are over 120 confirmed cases. It's taken just 4 days for the number of people confirmed with coronavirus to almost double. These are clearly unprecedented times, and we've not in our lifetime ever faced a pandemic on this scale. The situation is evolving quickly. Things are changing daily, and they will continue to do so for some time. I appreciate this can make some people worried, and understandably so. Coronavirus presents an enormous public health challenge. But in that lies an opportunity for us to demonstrate our value in a new and changing environment. This is a time that will require all of us at Ambulance Victoria to be agile, that we can continue to adjust our response as the situation changes. A time to work together as one team. This is a time to remember to be kind to each other, to make an extra effort to look out for and look after one another. While you may not have seen too much change at work until now, the planning and preparation has been going on behind the scenes since late January. Safety is always our number one priority, and evidence-based infection control is front and centre of our coronavirus response. For many of our administrative and support people, and for me and my team, this now means largely working from home. Many critical functions that can't, for the moment at least, be performed from home, like secondary triage and payroll, are now in isolation. For those at the front line, keeping you safe and healthy means paying scrupulous attention to infection control procedures. You're not just protecting yourself and your family, you're also protecting the community. Our role in flattening the curve, that is slowing the rate of infection so the public health system can cope, is one we take very seriously, and we can all make a difference. The community relies on us in times of need, and we remain ready and able to still meet the demand of our services that existed before coronavirus and will exist when this pandemic passes. I have been absolutely humbled by the community support for us, from messages of concern and well wishes to chocolates being delivered to branches by members of the public. And they can continue to help us through hand washing, social isolation, and importantly, by saving 000 for emergencies. We will continue to push this message strongly, particularly in light of the expected increase in demand in the coming weeks and months. You'll hear more from me on a regular basis. As always, I'll be honest and forthright with you, and also tell you if one of us tests positive for COVID-19. I will tell it to you straight. We will provide you with access to all the most current information so that we can support each other while maintaining our collective obligations to care for the community. As we look to the weeks and months in front of us, there will be difficult days ahead. But the one thing I can tell you with absolute certainty is that if we work together and look after each other, we'll definitely make it through to the other side.